Hi, in this tutorial, I'll show you key endoscopic access techniques and implant insertion. With Real Imaging Lite App and RealSpine Basic Endo, surgeons can train more precisely and reduce learning time.
Hi, here's Bernal from Realist. Today I want to present you the best technology for training in spine endoscopy. Now, give me 2 minutes and I will explain you everything what you can do with this model. Together with the technology of the Real Imaging Lite, make the perfect combination for improvement your spine endoscopy skills. First of all, you will have a model with the levels from L2 to S1. That means you can have 8 trainings for every site. In this case, you can have training for L5S1, L4S5, L3S4, and L3L2 for transforaminal. 4 transforaminal trainings, but also you can have the training for interlaminar in the same levels. S1, L5, L4, L3, and L2. Okay. In total, you have 8 trainings from right side and 8 trainings from left side. Very important to know, this model is also practical to use not only with monoportal but also for biportal. This is like a real patient. You can use the same technology that you use in the operation room. The combination with the Real Imaging Lite allows us also to make the perfect technology for also make the planning for the incision and the planning for the access. Okay, with this model we can also not only work with the transforaminal, but we can also work with interlaminar approaches. In the same way you can work with monoportal or with biportal approaches. With the combination of the RealSpine Basic Endo and the Real Imaging Lite, allowed also not only to have the access but also to make the planning of the access. You want to see which level you want to approach and also what is the angle of approach depending if you go interlaminar or you go also transforaminal. With the Real Imaging also allows you very easy to make the planning about the level that you want to approach, to make the planning of all the operation in order to achieve the angle. You can planning also the interlaminar approach and you can planning also the transforaminal approach. And also for the start of the surgery, you can also start the planning of the level planning, what you want to make the operation, and also the planning about how you can make the incision for the transforaminal approach. And remember, the wow starts with the real.
A unique solution that combines virtual training with hands-on practice to refine minimally invasive procedures.